What if the key to helping young people build healthier habits isn't telling them what to do, but making the healthy choice the fun and easy choice? In this episode, we're joined by Mary Dunn Stewart, CEO of Richmond Fit4Kids. This organization is working to change culture norms around health and wellness for young people. From school gardens and hands on cooking to active classrooms and after school programs, their focus is on helping young people experience healthy living in ways that are not only really engaging, but accessible. Instead of framing health around weight or restriction, they figured out something much more powerful: creating environments where learning about food, movement, and overall wellness are simply part of everyday life. We talk about meeting youth where they are, giving them voice and choice, and how building strong, reliable partnerships with schools makes it easier for educators to adopt programs without adding more to their already full plates. Because when healthy choice is easy for everyone, it doesn't feel like a program, it becomes part of the culture. Let's get into it. We're meeting with real leaders shaping a healthier future for our young people. We dig into what motivates them and how their work makes a difference. I'm CJ Sturmer, and this is the Champions for Youth podcast. Hi, Mary. Thank you so much for joining me today. I appreciate your time.
Hi, CJ. Thanks for having me.
So, Mary, you have this incredible organization, Greater Richmond Fit4Kids. And you all do a great job of really getting kids involved with gardening and introducing them to food and cooking and getting them excited about those things. And you also have done a really good job of finding creative ways to include movement, which I love. And I want to get into all that and learn about what it is that you all do. But I'm curious, what got you into this work? What has this journey been like for you?
Sure. So I volunteered a fair amount as a child and a teenager. And when I was in college, I wanted to volunteer at a hospital and I went to sign up and there was actually a wait list.
Oh, wow.
Yeah, I was kind of like, well, if there are plenty of needs in our community that I'm sure don't have a wait list. There was, an office that helped you link up with different volunteer opportunities. And there was an organization called the Williamsburg AIDS Network. So I started volunteering there probably my junior year. And first I did a training to become certified as an educator. And then I would go into schools with someone who was living with HIV or AIDS, and we would present and give health prevention information of this is how you put yourself at risk. These are ways to stay safe, and kind of do a lot of myth busting. This was the 90s.
Right. Oh, wow.
And then I became trained and became what was called a buddy or an advocate. And I worked one-on-one with a client and provided like a lot of support with a whole variety of different things. And it really just opened my eyes up to a lot of things that I had not personally been exposed to before. When I graduated, I got a job, a corporate job, and I just really kept thinking back to that. And the two women who worked at the Williamsburg AIDS Network were both social workers. So I literally knowing nothing much more than that about social work, I thought, okay, that's what I want to do. And so I went back after a year of being out of college and got a master's in social work, and then just have proceeded in all of my roles, have had a focus on children.
Wow. That takes a special kind of person to work in HIV and AIDS care, especially in the 90s. As an openly LGBTQ person, quite familiar what it was like back then and how hard it was sometimes to find somebody. And it shows your dedication, especially to building the awareness and education around something that impacts so many people.
Thank you. Thank you so much. And people always say this, but it really is true. I learned so much. And I just think back of one time being in college and the client I was working with was fairly ill, and I was going to pick him up to take him to the grocery store, and he was too sick. So I went, and he gave me his food stamps. And at the time, it was food stamps, right? SNAP now. And it was looked like Monopoly dollars or something. And I'm wearing like a William and Mary, like sorority t-shirt. And I'm walking into the Food Lion with food stamps. And it just exposed me to sort of like shame and stigma in ways that like was fortunate to not have experienced as a young person or in my life. So I learned so much, and it really was a gift in so many ways. And you're right that like people, who were living with HIV and AIDS were kind of ostracized from their families. People were afraid. Like it was just it was a very different world. And it really was like a gift to me that I was able to like play a part in these people's lives and learn so much.
You have the opportunity to position yourself to understand that stigma. And I think that's really powerful. And I think a lot of people sometimes don't get that exposure in the work that we do. And I love that. And I think that that's a really good message and an example for folks of that empathy and putting yourself in those shoes, especially at such a young age, and learning that. So you went through this amazing journey and then got into social work just based on not feeling fulfilled in the corporate world. I can actually relate to that. I've been in that situation, which is why I continue and jump into this area because it's so important, right? Like we love to help our young people.
Mhm.
How did you get to Fit for Kids? What was that journey?
When I graduated with my MSW, I first worked at a small nonprofit called the Virginia Interfaith Center, which was amazing, doing policy and social justice work. But the issue areas I focused on were primarily with children and healthcare. And then after a few years, I went to Voices for Virginia's Children, which is a statewide policy research advocacy organization, again, working in children's health and child welfare issues. And then I had been there 6 years and I saw the posting for Fit for Kids. And it was a brand new organization. It was being started by Sports Backers. And Sports Backers is a bigger nonprofit in the Richmond, Virginia region. And anybody who's in Richmond will have heard of them. But their mission is to make Richmond the most physically active community in the country. And I was and am a big fan of Sports Backers. I had done a few of their training teams actually for different races that they do. And they wanted to start something new. At the time, it was framed as childhood obesity prevention.
Mm,
And they felt like it was outside of their mission because they do physical activity, but they don't do food and nutrition. So they thought it was important to take a more comprehensive approach. And so they decided to start a new nonprofit organization with support from the Robbins Foundation, which was a
mm.
local funder who we would not have been able to get off the ground without their support.
So you all have evolved over time, and now your mission has really changed to include I like how you all put this overall health and wellness, right? The physical
Hmm.
activity, healthy eating. You also do some policy work, to my understanding as well. What has that
Yes.
evolution of the organization been like?
Yeah. So we were founded in 2010, and I have been here for over 14 years at this point. So I've been the only director of the organization and have been here, kind of the whole time from when we were two staff to now, over 12 full time staff members and seasonal staff members and a dozen AmeriCorps volunteers.
Wow, that really speaks to your passion.
Yeah, thank you. I'm really proud of it. So we started out, our board, even before I was hired, did a preliminary needs assessment to go around and did dozens of site visits and interviews to figure out what is the need in the community, what do people want, schools, partner organizations, what already exists, we don't want to duplicate. And we really found there was a need in two different areas. One was regional collaboration and kind of working together, learning from each other about all the great things that were already happening. And the second was direct programming with kids, particularly prevention programming. So it really started out with programs. So our Learning Garden program, which grew from, just one site to 6 sites to 10 sites to now 54 Learning Garden programs around the region.
Wow.
Yeah, it's very exciting. And we have a focus on Title I schools. So schools that have a high percentage of students who qualify for free and reduced price lunch. And then our wellness integration program, we modeled on a program in Williamsburg, Virginia, where we have trained, experienced teachers on our staff, and they work with partner schools to incorporate movement into the classroom. And our teachers go in and will lead an active lesson. And it might be a math lesson, a social studies lesson, a language studies lesson, but the kids are up and out of their seats and moving while they're learning. And so we've just continued to grow and add new programs over time to reach different ages of kids. Our first programs were with elementary and then middle, and then we added some college programs. And our final piece in that puzzle is this year we're adding early childhood and high school. So really trying to reach the whole lifespan of kids to
Right.
offer movement and nutrition gardening program.
That's just really cool that you focus on this whole health and wellness lifestyle.
Our tagline is to make healthy fun, and that's really the approach that we try to take, especially with children. We want them to move their bodies, we want them to play, we want them to have fun, we want them to have a flexible palate and be willing to try new foods, to smell things in the garden, to taste things. And it's just really important that we have a positive frame. For example, I shared earlier, we used to frame our work around obesity prevention, and we don't really use those words a lot anymore for a whole variety of reasons. It's really negative. It focuses on weight instead of health, and there can tend to be sort of shame and stigma that's attached to that. And it
Right.
also makes it seem like an individual problem or issue about somebody's body versus there's a lot of systemic factors to it related to food access, neighborhood safety, poverty. And so we really try to take a much more positive frame, use words like, growing healthy kids, growing healthy communities, making healthy fun. We really promote recess in that elementary school kids all have access to recess, and that
Right.
we don't take away play as a punishment. If a student gets in trouble, you don't say you have to run laps, right? Like we don't want to use like movement or physical activity
As a
as a punishment in
punishment.
any way. Yeah, because
Yeah.
then it's like the thing we're trying to get students to like join a fitness club or a run club or whatever movement. And if in their heads they think this is the punishment for when I get in trouble,
Right.
like
Right.
you make it a much harder sell, right? So it's really just about, having a positive frame and introducing everything in just a very positive way.
Right. I think you bring up a good point, especially early on in that early childhood, elementary school age, even through
Hmm.
middle school, right? These young people are going through such developmental periods. And if we're using the positive things we want them to do as punishment, they're not going to do that. And I like that you all don't focus on weight, right?
We don't at all.
It goes back to that feeling punished, feeling individualized, feeling otherized, and not feeling good. That can really affect young people mentally. And so, not focusing on those things, I think, is a really effective strategy to get kids excited about what they could do and having fun with it. Talk to me a little bit more about that. What is it like in the classrooms? How are you all developing these programs and making this physical activity playful and fun?
So when we think about our approach, it really is different for different age levels, different grade levels. So for example, we're just launching an early childhood program. And what the research tells us is that if children are outside, they are much more likely to be moving their bodies. So how can we work with partners and with childcare centers to do more than what the minimum requirements are for outdoor time? But how do you maximize outdoor time? Because if kids are outside, they're moving their bodies. With the middle school level, one thing we've really tried to do is amplify student voice and student choice. And so with our Game On Girl program, it's an after school program for middle school girls. And when we first decided to move into the middle school space, we did a lot of research. And what we found is that all adolescents become less physically active, girls more so than boys. And then there's pockets of girls that are the most, like girls in rural communities, girls in urban communities, girls in low income communities. And so we have a program, and it really is targeting girls who don't self identify as athletes. So we have sports and physical activity components, but it's meant to be like introduction, and you don't have to like everything, right? Like none of us
Right.
like everything. It's figure out what you like.
It's not a one size fits all.
No. And we do like non traditional. It's not even necessarily that you're going to join a sport, but if you do, that's awesome. So we'll do things like basketball or volleyball, but then we'll do things like floor hockey, yoga, dance, and we do cooking and cooking challenges where we'll do like a smoothie challenge where we'll bring a bunch of ingredients and you'll break into teams, and each team will like create something with whatever the ingredients are. And then we'll have like judges and sort of a, chopped challenge kind of situation. At the beginning of the 10-week session, we will survey the students because we have a whole variety of different health lessons, leadership lessons. So the students in that group get to like pick which lessons they are most interested in, what topics they are most interested in, and then we can accommodate that. Because as much as the students are able to share their perspective and decide what they want to do, the better. I mean, many of us are familiar with teenagers and worked with teenagers, and if we're able to align with their interests, it's going to be much more successful.
You bring up a good point. We talk about that proverbial seat at the table. And I love that you all
Hmm.
have not only let them have that voice, but the option of choice. I think that's really
Hmm.
cool because then it gives them the motivation, right? Like I remember when I was younger in school, it was, we're playing these sports and we're doing these things. You have to get out there and try them. As a kid, it was like, well, I don't know how to play these things. Am I going to be bad at it? What if I wanted to do something else? So you all being able to give them that choice really increases that motivation to want to do it. And I think that that's really, really cool. And then you
Hmm.
end up building that camaraderie. And I like that it's very community based, right? It's not this
Hmm.
individual, you need to go do this and you should play basketball and you should
Mm.
play hockey or whatever it is that you do. It's really, really community based. What has that been like for the students? What has that impact been
It's
like for them?
wonderful. Yeah, it's amazing. So we've been doing the program for a number of years now, and we have it during the school year. And then we also have a summer camp, 50 plus girls who will come together for 4 very long, jam packed days where we do learn to ride a bike or bike riding. We'll get on the river and do kayaking, paddleboarding, that sort of thing. We done sessions with the VCU women's basketball team, with our local professional soccer team, the Richmond Ivy. And a couple years ago, we had a student from one of our first years who DM'd us on Instagram, and she was in a local university here. And she reached out and asked if she could volunteer at our summer camp. And she had
Oh,
been, yeah, she had been a
the
student
pay
who'd
it
been in the
forward.
program at her middle school. So she is now the last 2 summers, she has been a volunteer coach. And she just brings this amazing, beautiful perspective of literally having been a kid who had been in the program and now she's a coach. It's just really exciting to have things like that happen.
Yeah, you have this long-term impact on folks that really help them to develop this passion and then pay it forward. And it's
Hmm.
really neat because then she's able to talk about, hey, I was once like you. I was one of these kids. And that
Hmm.
domino effect we've seen is just it's such a good way to be a really cool role model and a really unique way for these young
Hmm.
people. I really commend you all on that.
Thank you.
So you also do a lot with nutrition and introducing kids to foods. And what has that been like? How are you all able to do that? And then also actually get kids to be involved with food?
We have about 54 school gardens now in our region, mostly elementary school, but some middle schools as well. And we are not registered dietitians. We are not giving specific any kind of like clinical or nutrition advice. We try to keep it really, really simple and just say, eat more fruits and vegetables, drink more water, be willing to try things, and very low pressure, low stakes environments. So our garden educators will go out, we will have lessons in our learning gardens. And again, particularly during the school day, they will be aligned with science standards that are being taught. So
Oh,
it
wow.
might be
Okay.
parts of the plant or weather or how we're making the soil healthy, but we will graze and taste things growing in the garden. And then we also have tastings where we will bring in fresh, raw salads, different samples. And so, for example, like kids love pizza, right? So we do a
Yes.
pizza salad where it's really just the flavors of a pizza. So it's like tomato, peppers, basil, olive oil. It's very simple, fresh ingredients to get kids to try and taste new things.
Right. Very rare that I hear a child that doesn't like pizza.
Yeah, yeah. So we also, our educators, we really focus and train on how to introduce things in a low pressure way. It's not compulsory, right? Like you don't have to
Right.
try it. But what we find, particularly at the elementary school level, is that kids are invested. They're in the garden, they're planting seeds, they're growing, particularly if their schools had a garden and they're doing it year after year, that they are much more open to try things. And sometimes parents will be shocked and they'll say, like, my kid's not going to eat this or that or what have you. When their parents not there, it's just their peers, teachers. They are much more flexible and willing to try it. We talked to the kids even before about like our rules about tasting and like we don't yuck anybody else's yum.
Really promoting this behavior around
Yeah.
it.
Yes. Yes. And the vast majority, like I said, the vast majority of kids will try it. Most of them like it, ask for seconds. We just have had really positive experiences in going into the classroom, pulling the kids out, and when they're doing it with their peers in their own school garden.
With a lot of folks I've talked to, they have a similar strategy. My friend over here is doing it. Maybe I should do it too. It's that
Mm-hmm.
modeling of someone that's so close to them in their classrooms and that community aspect. It's also important, I think, to call out that you're teaching these skills and making it more accessible. These foods are at their fingertips. They've grown them themselves. They're getting excited about it. And I think that's really cool.
When we do gardening with middle schools, it's an after school program. And so we also do a cooking component, particularly in the winter, because in Virginia, it's really unpredictable, but you don't
Right.
necessarily want to be going outside like places like California.
Right. You guys kind of had a lot of snow this year.
We really have. What we have found with the cooking classes is kids really love the opportunity. Kids love cooking, right? Like so many kids love cooking. And I actually have co-led some of our cooking classes in the past. And in one of them that we did a couple years ago, we piloted and invited students. They could invite their caregiver, parent, and we did have some pretty good engagement. We always had to-go containers. And so students would just be so excited to like have their portion and maybe get extras and take it home because they really
Right.
wanted to show whoever was at home what they were trying, what they were cooking, because they really did have like a pride in what they created. Another super fun thing that we've done with older students, like a chili cook-off, chili competition.
Oh, that's so fun.
Yeah. So the week before, usually, we'll get them to like come up with their ingredients in their list. And everything we do is meatless. Honestly, mostly because from a food safety perspective, it just makes it a lot easier. Everything we do is kind of fruit and veggie forward and fruit and veggie centric. And so they do a chili cook off. And we had this one student here had cocoa powder. And, so we got cocoa powder because that was going to be a secret ingredient, which is actually like a thing. I haven't
Yeah.
tried it, but like I was looking it up online and it actually is a thing to put in like cocoa powder. It didn't work out great in that
Oh
circumstance because he kind of
no,
like he overdid it.
not chocolate chili.
It's good to try, right? Like it's
Yeah.
good. Sometimes kids can feel like stressed, or even I sometimes it's like, I'm following this recipe. It has to be good. And like sometimes it doesn't work out and it's okay, right? Like sometimes I put a
Yeah.
little too much of that in. It's going to be okay.
I'm in my 40s and I'm still learning that. Like, oh, maybe
Right.
that was a little too
Right.
much.
Yeah. Yeah. Oh, that was too much of that ingredient. But again, and even doing like another thing when we're cooking that's really popular or that we do some of is different bowls. So like creating, a bunch of different things because kids do have their preferences. So it makes it just really accessible. If you have like a bunch of different things that you can then put together, then it can really meet like what they are interested in.
What a great way to learn new skills and confidence and then be able to take that home to have the practicing mentality and then get parents excited that they're doing that. It
Hmm.
just has this really cool downstream effect. One of the things that I also often hear, especially with educators, is they often feel overwhelmed and they almost have this reluctancy to do these types of programs because they're like, oh, it's just one more thing I got to do. I just need to get through my lessons plans. I have requirements. How are you all helping to alleviate that type of feeling for these teachers?
Absolutely. Teachers are some of our closest partners. My husband was a teacher for many years, and we have multiple teachers on our staff, and we recognize how challenging their jobs are,
Right.
especially in the last 5 years. So, what we try to do is really provide resources or another tool for their tool belt that makes their work easier. So, with our wellness integration program, we have hundreds of sample lessons. They're
Oh,
on our
wow.
website. And then the schools we partner with, our teachers actually drop in and lead lessons. And it really is like, leading subtraction tag or famous face relay race. It's just taking whatever the content is and instead of a worksheet or a tablet or whatever, the kids are up and moving their bodies and it's kinesthetic strategies. So, some of
Mm,
us learn by hearing, some, by reading or seeing, by doing, and by moving your body is another way. And really all of us learn in a lot of different ways, right?
right.
But it's a way to really engage students and have them moving while they're learning. And with our learning garden program, like I said earlier, it is aligned to the standards in our state. It really does reinforce what they are already learning. And I totally get it. Some might be a little skeptical and be like, oh, if I get the kids moving, they'll be like all ramped up and riled up. But we also focus on mindfulness and we have a process to what we do. Our educators will say, what do we do when I'm in the room? Like we move and we learn, and they'll do like my body, my space. And at the end of the lesson, they'll really talk them down in a meditative, mindful way so that when our educator leaves the room or when you're ending an active lesson or like a brain booster, the kids are back in their seat and they're focused and they understand the expectation of whatever is going to come next.
Wow. It's this full picture.
Yeah, absolutely. But we also try to provide support for the teachers, right? Because they
Right.
have really challenging jobs. So at some of our partner schools, we do different like challenges for the teachers and we kind of customize them to what that particular school might want. So might be like a step challenge or a healthy hydration to try to increase the amount of water that you're drinking. And something we kind of tweaked it in the last year or two because we would have like a prize for whoever had the most steps or what have you. But as someone who is not going to be the person who's going to have the most, I
Right.
really feel like I work with, as you can imagine, I work with like a lot of like very active humans. So what we try to do is instead is set an individual goals. CJ's goal is going to be different than Mary's goal, right? Mine's
Right.
maybe 10,000 steps a day. CJ, you're probably at 20,000 steps a day with that California weather. At the end of the challenge, like if you've met your goal, then you go in for like a drawing for different like gift cards, water bottles, yoga mats, whatever it might be. But it's again, it's not like you're comparing to like a standard that should be the same standard for
Mm,
everybody. It's like personalized for like what goal do you want to reach. And I just feel really strongly that that's a much better way to be really inclusive because
yeah.
everyone's going to be starting in a different place.
That's such a good point. So not only are you helping to alleviate the pressure of, oh, I just have to do one more thing. Oh, we will actually come in and we will help train and provide these
Mhm.
tons of hundreds of free resources that you can
Mhm.
already build into the curriculum that you're doing so you
Mhm.
don't have to reinvent the wheel, and it gets them
Mhm.
excited. And then it's another great way of meeting kids where they are. Not I have programs, let's go meet them where they are and go into a school. You take it
Mhm.
one step further and understand that everyone has, like I said, a different starting point. So you're meeting the
Mhm.
individual child where they are. So it's like, how do we get you to do more steps? How do we get you to drink more water that is best
Mhm.
fit for your lifestyle, if you will, as a young
Mhm.
person? You're changing culture in this entire
Mhm.
school, like behavioral culture throughout their
Absolutely.
entire learning experience in school, which I think is really, really, really powerful.
Yeah, there's in public health there's sort of like making the healthy choice the easy choice.
Right.
And you see it in a lot of different ways. So in the past, we've worked with some schools in their cafeterias, just even about how you present the food and like putting certain things at like eye level and up front and putting
Right.
certain things first. And then kids are much more likely to like take it if just based on how it's presented.
Such a good point.
Yeah, and we partner right now with Richmond Public Schools and VCU on a healthy hydration initiative. And RPS has transformed and had all their water fountains into bottle fillers. And then we're really doing a research project with VCU to see how do we get kids to drink more water throughout the day and really trying to alleviate the barriers of, providing kids with water bottles, having a system for how do they get cleaned. And so that's just been something, again, to really try to just make the healthy choice easy and part of everyone's regular day.
Oh my gosh, that's so funny. That's with Dr. Melanie Bean. We actually talked to her on this show and she talked about the water fountains and the bottles and what they learned through that process and the research that they've done with that and
Hmm.
how they were actually able to get young people involved with creating this program. What a full
Yes.
circle moment. I love that you
Yeah.
all have worked. Another good example of a partnership that you've done with a university to help facilitate that with people that have experience with that research with young people. What a full circle moment.
Yes.
Yeah, you all have to go
Yes.
back and listen to
I was going to
the
say,
interview.
everybody go back and listen to Dr. Melanie Bean because she's a rock star and we
She's a
partnered for
rock
over 10
star.
years. She's so brilliant and smart and just committed and community minded. And yeah, she's just an amazing partner. And we have done so many projects over the years. And the healthy hydration has just been a really innovative, exciting partnership.
The episode is called Building Youth Programs with Dr. Melanie Bean from Children's Hospital of Richmond at VCU. Please go back and listen. It's really cool. How do we replicate this? How do we empower the people listening to this who work with all kinds of young people throughout all kinds of professions, whether they be educators, allied health providers, all kinds of people? How do we empower others to think differently and to replicate such great results?
Again, I've said it a number of times, but really engaging youth and giving them voice and giving them choice. And also, we've talked about a number of times is meeting people where they are
Right.
without judgment or shame or expectation. And like I mentioned, we say like our focus is eat more fruits and vegetables. It can be canned, it can be frozen, it can be fresh, it can be organic, local from your farmer's market.
Right. Whatever's accessible to you.
Whatever is accessible to you is a great choice, and not having judgment or expectations and collaboration and partnerships.
Yeah. Can't do it alone.
Fit for Kids would not exist if not for collaborations and partnerships. Except for our summer camp, people don't sign up for a Fit for Kids program. So a lot of times we'll be asked to like, will you table at this fair or community event? And many times we will, and we'll have an activity, but people will say, this is awesome. How do I sign my child up? And that's not how we operate.
Mm.
We partner with schools and where after school programs where the children already are. And so those partnerships are absolutely essential to any impact or success that Fit for Kids has had over the years. And then also, I've been doing this for a long time now is starting small.
Right.
Sometimes a school will reach out and say like, I want to have a farm. And I'm like, really? Because that is a lot of work. It's not so hard to get money to do the soil, wood, build a new, garden or a farm, but it's the ongoing. And so we
Mm.
just really always suggest, start small, 4 raised beds. Let's see how it goes. If you have a lot of engagement and volunteers and that sort of thing, it can be something that grows, but let's start small and have some success and see how it goes, and then move forward.
Right. Start small and use that as your way of getting the partnerships. I want to talk a little bit more about the partnerships and how folks are able to do those. Some of the things that I've heard when I've talked to our allies and what we do is sometimes they struggle with getting these partnerships. They struggle with getting in the right doors and getting the yes and getting people to listen. What kind of advice would we offer to those people?
I think, especially when you think about partnering with schools, it's so incredibly important to show up, do what you say you're going to do, because we have worked with partner school before, and sometimes they can be a little, oh, I'm not so sure. And it's because all the time organizations, people, volunteers are coming, say they're going to do stuff, and the school invests time into making something happen, and people back out. They don't follow through. And that really is a resource drain on schools. And so it's really, really important to only make commitments that you're able to fulfill. And
Right.
also, credit is not the most important thing, right? Like, we're out there doing good work. There is enough work for all of us in this world right
Right.
now. There are a lot of kids, a lot of communities that we can partner with, that we can collaborate with. And so it is not the most important thing that Fit4Kids has top billing on whatever project that we're doing. In fact, when we're working with the schools, it's the school's garden. We are trying to support the great things that they're doing and bring
Right.
our expertise and our programs and our insight. It's okay to share the credit and always be fulfilling whatever your commitment you're making.
Yeah, and schools want that, right? They want to be able to show to parents and to families, your kid is in the right place. We take care of them. We provide really good education and experiences. And we also have people that know how to do that, that help us, right? Not only showing up, but consistently show up. Be very clear
Mhm.
about what it is that you're able to do and make sure that that value is there, right? Not just value to the students and families for participating, but value that you're being able to show consistently with these partners and these schools. I think that that's really, really powerful. Everybody, please go out and learn more about Greater Richmond Fit for Kids. Their website is grfit4kids.org. They also have tons of resources. Mary talked about hundreds of resources. If you go to the website, there's a tab that says resources. Go download them.
Or email us, contact us if somebody would like our lesson plans, our recipe, anything we are willing to share. We just feel like it's the right thing to do is make these resources available as widely as possible.
That's incredible. Congratulations on all this success and getting our young people to focus on that overall health and wellness, changing lifestyles, building new culture norms. Miss Mary, I really appreciate your time today. This has been a great conversation.
You're welcome. Thanks for having me.
A huge thank you to the Virginia Foundation for Healthy Youth and Prevention Connections for their support, and thanks to Mauricio Reyes for creating that great music score. Don't forget to share this with others, because the only way we can make real change is if we do it together. And hey, if you like today's conversation, go ahead and give us that 5-star review. Now go out there, everybody, go do good. Thanks for listening. We'll see you next time.